Hello, Pain Free for Life members. This is Dr. Rob Van Bergen, and welcome to another Monday 10-minute training. Today, I'm going to be talking to you about migraines and how to treat these using, you guessed it, microcurrent therapy. Now, I have talked extensively about headaches and migraines in the past, and if you follow any of that, you're going to know that there are so many things that can help. There's certain meridian points to the treatment of the liver directly, painting the neck and shoulders, vagus nerve, even direct stimulation on the brain. But for today, I'm going to focus on three of the most effective methods that I have found, and I'm going to demonstrate each one of them. Now, I'm going to try and do this all in under 10 minutes as per the training requirements of the name of the title. But sometimes I go over. I think I did 15 minutes last week or the week before. So stick with me. We'll get through all of these. All right. So number one is vagus nerve stimulation. And surprise, surprise, I know that Dr. Rob is talking about vagus nerve. But there is a reason. Vagus nerve is absolutely incredible for migraines because it turns that inflammatory response down. And it actually helps you or the person you're treating shift into this parasympathetic state, which reduces stress on the body, which can often be the cause of migraines and headaches. You've got to remember there's always a trigger, right? Something is going to trigger the headache to begin with. If you need to get rid of it, you need to know what that trigger is. Now, the vagus nerve covers so many of these different things, so it is a really good starting point and is the first treatment I do when I'm dealing with someone that has a migraine or even a basic headache. So for vagus nerve stimulation, I like to use the Y probe. I've tried all of our different tools. I still haven't found anything that does this quite the same as the Y probe does. Now, either the Avasia Life Evolution, the Pro Sport 3, or the Avasia Life Pinnacle can do vagus nerve stimulation. I'm currently using my Pinnacle because all I have on my desk are two Pinnacles and an Easy Lift. So I'm going to demonstrate with the Pinnacle. So I turn the device on and I'm going to be looking for the mode 7 to 12 hertz. Now, this is the same if you are in the Evolution. You just press your mode button until you get to 7 to 12 hertz. And if you're in the Pro Sport 3, you're going to need to scroll down and look for the mode FM 7-12A. Now, when we do vagus nerve stimulation, we're going to be doing it through the neck. So we want to make sure our neck is exposed and available. And we need to be looking at the left side specifically to start with, because this is a migraine treatment here. So on my left, I'm going to feel for my carotid artery. I'm going to just feel until I feel a pulse. So I'll turn my head a little bit here. And I'm pretty good at just putting my fingers right on it anyway at this point. But so I'm going to go right behind where that is. You can see where it's sitting on my neck here. It ends up being roughly about an inch below the earlobe each time. Now, what I'm going to do at this point is I'm going to adjust the power until I can feel it by holding down the plus button on the device. And I'm putting moderate pressure here, but not enough to be uncomfortable. Now, when I am increasing the power, I want to do it until I feel a jiggling in the neck. And then I need to make sure I'm controlling that jiggling. You can do vagus nerve stimulation for between 3 minutes and 20 minutes. Now, if you've got a migraine, one of the best things to do is to do this with your eyes closed. Do some deep breathing as you go and just keep that stimulation comfortable and go until the 20-minute mark or until you start to feel relief. Now, an important component of this is if while doing the left side with migraines, you start to feel worse, the migraine starts to get worse, immediately stop and switch to the right side. So again, feel for the pulse. There it is. Go a little bit behind it and do the right side. Now, you don't need to do this if the left side helps. You don't need to do both. But if the left side makes things worse, you can switch over to the right and do it then. Otherwise, make sure you start on the left. Usually the left will resolve things, but if not, the right typically does. Now, if this didn't help, if you've got a migraine or you've got a headache, you did vagus nerve, it didn't make a difference, you need to move on to the next one on my list of treatments, and that is dosing and zeroing. Now, You can do this with any device. You don't need a device with a screen, but with the screen, you can take what we call initial reactions, and you're able to actually figure out where these highest points of inflammation are. Typically, what I'm going to be looking at doing is on the back of the neck, and it's hard to show this on myself here, but on the back of the neck, up in the hairline, next to the spine, you'll find some tension points that typically are areas where the headaches or migraines can spawn from and essentially travel to the front of your head. So, what I tend to do is if I'm using the Evolution or the Genesis, I would set my device to 60 hertz in the Evolution or 77 hertz in the Genesis. And I would kind of paint the areas a little bit there on the back of the neck and see if I find any sticky areas. If I found a particularly sticky area, I would put decent pressure on the area and I would hold the device in place until I dosed and zeroed, which is the blue light coming on for the dose. And then you keep holding it in place until all of the other lights flash on. And that will be your zero. Now, with the Pinnacle or the Pro Sport, I go into my first program, so Assess 60 Hertz or Relax Assess, and I hit the left arrow. Now, on my neck, I'm going to set some power on the back till I can feel a tingle, just a gentle tingle, which I can't feel very well. There we go. Okay. Once you've got a comfortable tingling spot there, you can feel the current. I'm going to take some readings. So I'm looking for my initial reactions, which is my top middle number. And what I would be looking for in a headache would be a very high number, something above 35 that stands out. Now, usually, I'm doing pretty good today, but usually you'll find something in the high 30s or 40s, or even higher if you've got a problem. Once you find that spot, what I want you to do is hold the device in place. So hold the electrode in place and wait for that dose and zero. That's the D to come on the screen. And then you wait until the Z comes on the screen afterwards. Now, once this is done, this means you have dosed and zeroed. So you have communicated with the brain. You've asked it to make change. The device has recognized that the brain has acknowledged it. And then we can start to treat. So once we've got our dose and zero, whichever device we're using, we're then going to switch to stimulate in the Pinnacle or the Pro Sport, or blue stimulate in the Genesis or the Evolution, and just hold it in place at a comfortable level for 2 minutes. Now, once this is done, you will have completed this section of treatment, and this should really help to tone everything down. But it's something that just requires a little bit of practice. And once you get used to using dosing and zeroing, you'll be very impressed with the results you get, because being able to just ask the brain to make a change in the moment is huge. It's one of the biggest functionalities of the machines and what makes them stand out and so unique. Now, number 3 would be Little Wings. Now, I know that Little Wings is one of those treatments that you either love or you hate. I've met some people that love the way it feels. I love the way it feels. I know some people that hate the way it feels. This treatment is going to eliminate tension. So if you've got tension headaches, tension migraines, it's going to do a better job at eliminating it than any other protocol. It also helps to normalize pressure and restore appropriate blood flow to the brain as well. So it can really help to restore a lot of these issues. So rather than sitting here finishing my dose and zero, now typically the mode you're going to use is 121 hertz. Now, 121 hertz in the devices is modulated on 3-to-1, which means it's on for 3 seconds and off for 1. So what you're going to want to do is you're going to want to set the power level lower or turn it off and back on again, right? So it's a 1. And you're going to place the electrode behind the ear like so, and then just drag it right down. And you're going to push into the neck. And then if you increase the power, it'll start to lift and drop, okay? And it will be an involuntary lift, so it's a little bit uncomfortable. But you want to make sure that you're getting the lift and the drop, even if it's a small little lift. And you need to get what we call 5 of the flaps. So this each shoulder raise being a flap on each side. So that was 4. Wait for the 5th one. Up it comes. And drop. And then you're going to go to the other side. It's important you do both sides. You get in there, and you're going to get the rising of the shoulder and the drop. And you do that 5 times. Now, it's important you do it 5 times on each side. If you go beyond 5, so let's say you do 10 because it's feeling good and it's relieving a lot of pressure, make sure you do the 10 on the other side too. You need to keep it equal, or you could risk putting your body out of alignment a little bit, which of course we can fix with microcurrent, but it's always better safe than sorry. And I think this is coming up to 5. Hopefully it was. So that is Little Wings. Now, if you have a Pinnacle or a Pro Sport, you can also program a different option in there, which is to go in, hit the up arrow until you get to AVA, select it, hit the right arrow twice where it says frequency. It should say 59.35. Then you hit it a few more times where it says damping. You hold the up button until it says damping 7. Then you hit the right arrow one more time and it says mod off. You see it says mod off here. Now you want to increase it by hitting the up arrow a few times until it says mod 3 to 1. Now, this is essentially a way of setting it so that it's a gentler frequency so you can crank it up higher and it's pushing it deeper into the body. So if you're the kind of person that finds Little Wings uncomfortable the 121 hertz way, this is the way to go to make it go deeper, be able to get you the lift that you're looking for, and potentially be a little bit less abrasive. But it is only available in the Pinnacle and the Pro Sport, and you do have to go in and program it yourself. Okay, so that is it for today's video. Now, typically one of these treatments in this order, so starting with vagus nerve, going to dosing and zeroing, going to Little Wings, is going to release and eliminate the tension or the tension headache or the migraine. And if you have any questions about any of these treatments, please don't hesitate to drop them in the comments section below. There's lots of different things we can try to go beyond this. It's just fitting them into 10 minutes was obviously impossible, even with the 3 I chose, because we're already nearing 12 minutes now. So if you have any questions, drop them in the comments below. I'll be happy to answer them. Thank you again for joining me, and I hope to see you next week for another Monday 10-minute training. Take care, everyone.